Congratulations and welcome to Mother Baby. Now that your special delivery has arrived, I want to go over some information for your stay. You'll be given a mother and baby care book to guide you through your postpartum time. In the inside cover of the book, you will find a code that gives you free access to an online app for 1 year. This app has several great videos, checklists, and trackers, and even lullabies and soothing sounds for your baby. You will also get a table of contents telling you which page to look at for specific information. My name is Kayla Reich and I am one of the clinical educators. First, let's talk about you. We are here to hold your hand throughout your stay. It is very important that you don't get up by yourself the first time, especially if you had a spinal or epidural. Let a staff member help you to the restroom the first time and you'll be shown how to perform pericare. You will use your pericare bottles with each void for at least the next week so that you will take these bottles home with you at discharge. For a vaginal delivery, if you have perineal stitches, swelling, or hemorrhoids, your nurse can give you a numbing medication to help with any pain. Around 24 hours after delivery, you can start doing sitz baths and take this home with you at discharge as well. For a C-section delivery, you will start on a clear liquid diet to ensure that you don't get sick. Let your nurse know once you start passing gas to advance your diet. It is important that you turn, cough, and deep breathe every few hours to prevent infection. You can splint your abdomen with a pillow to decrease pain. You will have a catheter for several hours after delivery. Your nurses will help you with pericare and changing your pad until you are able to walk to the restroom. No matter what type of delivery you had, report any heavy bleeding to your nurse. This means filling up a pad in an hour or passing several large clots. Report any pain to your nurse. There are several ways to manage any pain, such as warm blankets, pillow support, position change, and even dimming the lights. Your nurse will explain to you any pain medications that the physician has ordered and any side effects. Many medications have a side effect of constipation, and most doctors order a gentle stool softener that you will take twice a day while here. It's important to stay hydrated and eat a balanced diet. You have to take care of yourself to be able to care for your baby. Now, let's go over skin to skin and feedings. Skin to skin helps calm your baby, maintain their temperature, and even stabilizes blood sugar levels. It also helps babies become ready to feed. Sometimes babies can be very sleepy for the first 24 hours, and extra skin to skin time can help. Skin to skin can continue and has benefits in the days and even weeks following birth. Often, parents worry about when and how much to feed their new baby. Newborns have a stomach approximately the size of a Hershey's Kiss, so they may eat often. You should feed your baby based on their hunger cues, sometimes called feeding cues, 8 or more times in each 24-hour period. The best time to feed is when babies show early cues, such as rooting, sticking out the tongue, stretching, and putting hands to mouth. An agitated or crying baby is showing late hunger cues and may need to be calmed with skin to skin before feeding. Hold your baby close and make eye contact when feeding. This helps your baby bond and even helps brain development. All of our nurses have extensive training and are available to assist you with any issues or concerns. At Women's, we practice couplet care, meaning the same nurse will care for both you and your baby. We also practice rooming in, which means that we support mothers and babies remaining together. With you is the best and safest place your baby can be unless they require a higher level of care. The pediatrician and your OB should visit you and your baby in your room each day. Most tests and exams can be done at your bedside. We have several security measures to keep your baby safe while you are here. We recommend you put your baby's footprint somewhere out of view and secure. Your baby has a cord clamp with a security device on their belly button. This is another measure to protect your baby and is removed at discharge. Keep your baby away from the door and the door to your room closed. You will sign a security card with your baby's information on it. If for any reason your baby ever has to leave your room, the nurse should show you this security card with your signature. All women's hospital nurses have baby footprints on their ID badge. Your armband will match the ankle bands placed on your newborn. These numbers should be matched anytime you are separated from your baby upon their return and also at discharge. One of these bands will be yours as a keepsake. While you are allowed to walk in the hall, your baby should not. If you need to leave your room, make sure someone is there to watch your baby or call your nurse. Supplies will be in the drawers of the bassinet. There should be a nail file, and filing is recommended instead of cutting in the first days. The diapers have a wetness indicator. The stripe changes color once the diaper is wet, and they are even labeled front and back. You still want to check the diaper with each feeding and don't rely only on this indicator. This is a good way to know if your baby has a dirty diaper if it was wet also. If you have a little girl, always wipe front to back, and in newborns, know that some discharge is normal. While you're here, you will record all of your diapers and feedings, including the time and amount in the back of your mother-baby book on the baby's daily feeding log. Don't worry that you'll hurt your baby's umbilical cord when changing the diaper either. There is no feeling in the cord and it does not hurt. Simply fold the diaper down below the cord stump and it will dry and fall off at around 7 to 10 days. Sometimes newborns spit up a lot more in the first days, and this is normal. Sneezing during this time is normal as well. This is how babies get rid of the remains of amniotic fluid. You will have a bulb syringe and should keep this within reach. Depress the bulb, insert into the cheek, and release the bulb to suction. If your baby ever spits up and it comes out of both their nose and mouth, always suction the mouth before the nose. And how I remember that is M comes before N in the alphabet. One supply that you will not find is a pacifier. Artificial nipples and pacifiers are not recommended during the first 2 to 3 weeks until breastfeeding is well established. We discussed how often to feed your baby. To decrease spitting up, you also want to burp your newborn after feedings. If you've never burped a baby before, your nurse can show you how. Babies may sleep a lot in the first days in between frequent feedings. Try to rest when your baby rests. If you are very tired while holding your baby, it is safest to place them in their bassinet. We would never want a baby to accidentally fall. Babies should be placed on their back for sleep on a firm surface in one layer, and they may be swaddled. Don't overheat or overbundle your baby. There should be no pillows, large blankets, or stuffed animals in the crib. If you are trying to feed your baby and falling asleep, enlist the support of your helper or call your nurse. I mentioned earlier that most tests can be done in your room, and you're probably wondering what kind of test your baby may need. Each night while you are here, your nurse will weigh your baby and check their jaundice levels. Every baby loses weight after birth, and that is completely normal. We're just monitoring the percentage of weight loss. Jaundice is also normal in many babies, and your baby's levels will be checked closely if they are high. We check jaundice levels with a meter that we press to your baby's chest. If it gives us a high reading, then your baby's jaundice levels may be checked by a few drops of blood from a heel stick. Treatment for jaundice is phototherapy. It's just exposure of the baby's skin to a special light that will not get hot or hurt your baby. Babies will have a hearing screen done soon after birth, during a quiet time after a feeding. This involves placing 3 sensors on your baby along with a covering over each ear and is not painful at all. Most babies sleep right through this screen. Sometimes babies do not pass the first hearing screen, and this is normal also, and it does not mean anything is wrong with your baby's hearing. It will be repeated in approximately 24 hours if not passed. This can be due to fluid that has not cleared from your baby's auditory passages. 2 additional screens are done for all babies after they are around 24 hours old: a congenital heart disease screen and a newborn screen. The congenital heart disease screen is done by placing an oxygen sensor on your baby's wrist and foot and comparing those numbers. This tells us how your baby's heart is moving oxygen through their body. The newborn screen is a heel stick where a few drops of blood are collected and mailed to the Mississippi State Department of Health. They check for many rare disorders that may not be found immediately otherwise. These are all screenings, and you should always report any concerns for your baby to the pediatrician. Now, let's go over a few other considerations. If you desire a circumcision for your baby boy while you are here, you should discuss it with your doctor and nurse. A receipt from your clinic will have to be provided to schedule the procedure. Circumcisions may be done on the day of discharge, and your baby will be observed for at least 2 hours after. You'll be shown how to care for the circumcision, and you'll want to watch carefully to make sure your baby voids after the procedure. Remember the wetness indicator on the diapers? Only urine will change the color of the stripe. Some babies have a higher risk for developing low blood sugars. This does not in any way mean that they are diabetic. It is simply their body learning how to function. Babies that are large for their gestational age, small for gestational age, late preterm, or an infant of a diabetic mother will have their blood sugars monitored for approximately 24 hours. A late preterm baby is any baby that is less than 37 weeks. Just as adults check a blood sugar with a finger stick, we check babies using their heel to obtain a drop of blood. Late preterm babies need some more additional care. They should remain skin to skin for at least 4 hours, and bathing should be delayed. They should eat hourly for the first several hours and very frequently during their stay. If your baby was less than 37 weeks or weighed less than 2,500 grams, they will also need a car seat challenge test. Very small or early babies sometimes have trouble breathing while in a semi-reclined position. We will need the car seat and the base if there is one. Your baby will be placed on a heart and oxygen level monitor and observed in the car seat for at least 90 minutes. If the heart rate or oxygen levels drop during the challenge, the test will be stopped. A second car seat test will be performed in a special car bed that is flat. All babies should go home in a car seat, but only those needing a car seat test should bring in the base. Now let's talk a little about breastfeeding. Babies should latch on with a wide mouth, tongue down, and you should feel a pull and tug. Feeding should not be painful. If you feel anything pinching, burning, or biting, break your latch and try again. Break a latch by inserting a finger into the corner of your baby's mouth to break the suction before pulling them from the breast. If your baby is sleepy and not wanting to nurse, keep them skin to skin until they show feeding cues. You may also hand express and give colostrum to your baby. Have your nurse show you how to hand express and refer to your mother and baby care book for pictures. The most important first step in breastfeeding is getting yourself comfortable and getting your baby in a good position. Several different positions are shown in your book, and call your nurse as needed for assistance. Sometimes mothers are concerned when breastfeeding because you can't see how much your baby is taking in. As long as you see good output, meaning wet and dirty diapers, and your baby's weight loss percentage does not get high, then your baby is eating enough. We want at least 1 wet diaper in the first 24 hours, 2 on the second day of life, 3 on the third, and so on, until day 5, when we should start to see at least 6 wet diapers daily moving forward. If you are separated from your baby and want to express breast milk or breastfeed, let your nurse know. If you start pumping within 6 hours of birth, it will help ensure a good milk supply. When breastfeeding, your body uses supply and demand, so the more often you nurse or pump, the more your supply will be improved. If you are exclusively pumping, use a double pump for 15 minutes every 3 hours. If your baby is in the NICU and you will need a pump for home use, talk to your nurse. Any medications given to you postpartum by your OB are safe with breastfeeding unless you are told otherwise. In conclusion, we hope to have given you the building blocks for a great start. You should also receive a printout for how to obtain support and help after discharge. We are here for you even after you leave, and there are many resources available to you. Thank you.